Okay, so thank you very much for a kind invitation. I will discuss a little bit the gender leadership in anesthesiology and critical care. No conflict of interest related to this lecture. This is a picture, the 1603, the anatomical theater. What are you missing here? There are no women among doctors. So woman in anesthesiology and critical care and medicine represents innovation, growing, and progress. And this was well pointed out in a recent article on The Lancet, discussing the advancing women in science, medicine, and global health. And this is Professor Edith Matteau, Chair of Division of Anesthesia, Pain and Critical Care at Tel Aviv Medical Center, Israel. And I share with them many of these slides coming from a survey from the European Society of Anesthesiology, investigating the role of women in anesthesiology and critical care. The role of women in anesthesiology and critical care is very well defined. This is when we signed the Helsinki Declaration for Patient Safety in Anesthesiology with Professor Jannike Mellin-Olsen and Professor Van Haken some years ago in Helsinki. And this is at the National Italian Society, the last meeting in Rome in October 2019, where we celebrated the role of women in anesthesiology and critical care at the cloud. This is the gender distribution and residence among members of the Italian Society of Anesthesiology and Critical Care. In the Italian Society, we have more than 8,000 members, and almost 54–55% of them are women. More importantly, among members below 40 years, 60% are women, and among residents, 60% are women. So as you can see here, in the Italian Society, women are very well represented and are the majority in the overall society members, and more importantly, in the younger members of the society. According to the OECD Health Statistics 2015, you can see that the gender composition of doctors is changing, and the share of female doctors steadily increases in all OECD countries. On average, the share of female doctors was 29% in 1990, 38% in 2000, 46% in 2015. And as you can see, the highest amount of female coming in the medical field is in the Netherlands, Spain, Norway, Belgium, Iceland, and Italy. Further, you can see when you look at the gender management and leadership gap in academic healthcare centers in Europe, recent data suggest that very few of them, however, cover a position as full professor, 30% as senior doctors in the hospital, this is at least in Germany, 20% as full professor and 40% as senior doctors in the hospital in Sweden, 22% and 35% as full professor and senior doctors accordingly in UK, and in Austria around 20% as full professor. So around 25 to 40% females as full professor in university or senior doctors in hospital. When we look at the increasing of the role of females as department chair or covering institutional positioning in the hospital, you see that it will take at least 50 years to reach gender parity, unless the rate of change will accelerate. And Professor De Hart, the president of the European Society of Anesthesiology, launched an important program to promote gender parity and the role of women in the leadership and management in anesthesiology and critical care, and several initiatives has been launched by the society. In a recent survey among ESA members, what was found was that there were almost equal numbers among men and women involved in clinical or basic research. However, when we look at the public representation, there were striking differences between men and women. As you can see here, the lecturing at the national meeting, men are almost 70%. Lecturing at the international meeting, men are around 20%. And in various scientific and other committees, men represent at least 30%. This is always double the representation for women. So women are clearly underrepresented in the public representation. But what is holding women back from leadership roles in medicine? So it's a question of coming from medical students and the role of physicians. It's a question about the role of leadership and management position, or is a mentality issue within women. So this is a survey led by Professor Idil Matteau at the European Society of Anesthesiology in 2018. We see in a large number of subjects, almost equally divided between male and female. And the question is, do women wish to be really in the leading position? And what are their perceived career barriers? This is extremely important to develop evidence-based intervention designed to possibly close the gender gap. If you look at the demographics and you ask to women, you can see here that in a hospital with more than 500 beds, the women work at least around 63%. But the wish for leader career among women is only 48%. Chair, position as chair, in female role is only 33%. And the age of women less than 45 in the anesthesiology and critical care units is more than 65%. Interestingly, 57% of women have children, and at least they have at least more than 2 per family. So among men, they have again around 60% in hospital, 500 beds hospital. The wish for leader career is around 48%, like women here. Chair female is only 15%. When you ask to men, the age is less than 45, only 50%, so older than women, mostly non-residents, and 73% of children with around 2.3 each. So if you look at this data, male compared to female are older, more with partner and children, and more chaired by male. So do women aim at leadership position? If you ask in general, the women answer that the majority, they don't wish a leadership position, or this is a less percentage as compared to men. And what are the obstacles to career development for women that are considered? Mainly general issues, so missing research background, lack of leadership education, missing female role model, family level, so lack for part-time opportunity, lack of affordable child care, partners' career consideration, and responsibility for raising the children, and at a personal level, so missing self-confidence and less clinical time. So it's very important an organizational and institutional culture and relational interaction with staff members. Which are the perceived obstacles to academic leadership among women? It is not about the lack of spouse support, because more than 80% are happy. It's not about career developments of spouse, among 70%. Why you don't be in the leadership? This is the answer from women. It's about for more workload and less personal time in almost 84% of the case, responsibility to take care of children, 65, lack of part-time opportunities, 67, lack of comprehensive and affordable childcare in 55%. And we would rather spend more time with patients in 58%. If you compare the answer from male and female, we have striking difference. You see that if you ask why women have more problem in terms of leadership, you see that women really recognize more frequently compared to men the problem of less personal time and workload, responsibility to take care of children, lack of part-time opportunities, and lack of comprehension and affordable childcare, as well as the time spent with patients. If you look at the millennials, you have even more issues to be under discussion. The tech savvy, the crave feedback and guidance, and the team workers, since they believe that no person have left behind generation. More importantly, they trade high pay for fewer billable hours, the flexible schedules, and a better work-life balance. But more importantly, for millennials, it's important to prioritize family over work. So if you look at the career barriers, is very well recognized and is even more recognized by men as compared to women. A lack of leadership in education, a lack of research background, a missing self-confidence, and a missing female role model. So the strategic approach that has been suggested to really examine gender diversity by tracking data, report the results, as the European Society of Anesthesiology tried to do, to investigate causes, to implement strategy to improve inclusion in the position of leadership and management, tracking outcomes, and reporting results again. So the real solution is that women with more self-confidence in terms of role as leadership and management, more leadership possibilities in part-time jobs, which are clearly asked by women, support of leadership by department chair, which is extremely important, time for leadership engagement, education, coaching, and/or mentoring program, child care direct at hospital also at night and in weekends in order to better and optimize family and work. More importantly, the support from hospital and university management play a key role. So, human medicine needs some human evolution, coming from history to her history. The women must be really convinced themselves to write their own history in medicine. Thank you very much.